We now have our Ekam Uk team. We have first Dr. Preetham Bodhana, a consultant and nephrologist of a general physician at Gloucester Hospitals and NHS Foundation Trust. Fundraising and running marathons are his hobbies. We also have Dr. Rajani Lalnuri Somachi. She is a dermatologist specializing in pigmentation and cosmetics and works both in the private and public sector. And she was inspired to join Ekam's cause through Dr. Sai Lakshmi. And then finally, we have Dr. Ajay Kotagiri. He is a consultant ophthalmologist specializing in retina and inherited retinal diseases, working in the northeast of England, Newcastle and Sunderland, and is a funding member of Ekam UK. Now let us welcome Ekam UK to present today.
Hi, everyone. I'm Dr. Rajani, and I'm honestly honored to be this global webinar of Ekam. Today, I'm going to briefly introduce you to Ekam UK. So it was set up a couple of years ago, and it was sharing the same vision as the Ekam Foundation in India, with an aim to provide and support healthcare for every child and expectant mother, and also to support research, training, and partnership between UK and India. Next slide, please. So our objectives are to fund and support Ekam projects in India and also similar organizations in the UK, and also to partner with other organizations of Indian origin within the UK to raise awareness of Ekam within the UK and also to increase membership. Now, it was not easy to start off and to set it up. So we faced some challenges. Initially, to start off, registration of the Charities Commission took a lot of time and effort. A huge credit goes to Mr. Vaikund, who has not been able to join us today. And next slide, please. And then it took some time to get the trustees involved. People were a bit hesitant to come forward initially, especially many were concerned with regards to the medical legal aspects in this country. But eventually it started off with 3 trustees. And also it took time for the HMRC to approve these trustees are of good standing and allowing for tax exemptions. Next slide, please. Then the next step was setting up a bank account with the charities, which took some time, and also obtaining gift aid from the HMRC. Then we built up a website and social media profile. So Ekam UK is mainly looking for guidance and support, most likely from Ekam India, Ekam USA. We are relatively new and open to ideas. We'd like to start off with realistic, achievable projects, set up Friends of Ekam and youth ambassadors similar to the USA. Our strengths lie in our expertise, and that we're relatively new, so are open to ideas and changes and suggestions. Thank you. Next slide. Thank you.
Hi, this is Ajay Kotagiri. I'm happy to say good afternoon from England. So as you might have heard from Dr. Rajani, we are very young, and we've just started Ekam UK, and it took a lot of challenges to begin with, but we are here and we are ready to go. Some of the challenges we overcome very easily, but we could not help, troubled by COVID like everybody else. We started with a very small group of people, small events to begin with. We had individual donors and we raised a couple of events with few £100, but we had a kind of a breakthrough and we had a major push recently. We partnered with an organization called the Northeast Telugu Group. Next slide, please. So in the COVID lockdown, we were very worried, but fortunately, all the Indian families we meet in Northeast, the Telugu people, we were looking to raise some funds for India. And so one of the group members, Dr. Suresh, got hold of Dr. Sai Lakshmi and her work and come in touch with the Ekam's work in India and decided to partner with Ekam UK to raise money. And this program has been really successful. 32 children participated in it. They took up different sporting challenges. They challenged themselves and raised £9,000. They've now become official partners, and we've learned quite a lot from this activity. We'll look forward to working with NETG further and also create more local partners and official partners. And all the children, next slide, please. All the children have now become part of Ekam, the Friends of Ekam group. We would really like to learn from Ekam USA in implementing youth ambassador program, and the children currently who participated in fundraising were really enthusiastic and energetic, and this energy, I hope, continues, and we continue to provide support. And please see the video that was created from Dr. Bindu and Deepthi, who've been instrumental in running this program and helping it. We are finalizing the support that this program will do in India. Currently, we're looking at projects funding phototherapy units in local government hospitals in Hyderabad, which will be a local connection to people who have raised the funds. Thank you. Can you play the video now?
Hi, in these troubled times of COVID pandemic,
to help people in need, we, the kids of NATG North East Telugu Group,
came together to do a sports challenge
to raise funds in aid of Ekam Foundation
in different sporting activities like cycling, running, skipping, walking, etc.
We worked hard over a period of 1 month.
And we reached our target successfully.
with lots of support from friends and families.
We managed to raise £9,000
to support the Ekam COVID campaign.
We enjoyed it very much.
Yeah, we had so much fun.
We hope to continue this in the future.
If we could do it in our own time,
every one of you can.
And Dr. Preetham, you're next.
Namaste. Thank you. And I'm really sort of indebted to everybody for giving me this opportunity. I think I'd like to start off with my first slide. Just to reiterate to all of us and also to those who are following us on YouTube, the vision of Ekam, which is healthy and happy children with for the mothers and the communities. We all share the same mission as well as the values of Ekam. Next slide, please. For me and for all of us, life is about reflection and learning. I think in this last sort of an hour and a half, looking at all the slides, both from United States, USA, from what Neelima and her team have done, and also what Ajay has shown, and Rajini, I think there's a lot we can learn from what is already being done in both in India, such as collaborating Ekam with some other Indian charities like Abhayam, and also looking at all the fundraising and the sort of the social and the cultural activities that are taking place. Just like in United States, I think even in United Kingdom, what we have done is to get the Ekam UK registered, we have to go through the charity donations so that we can get the tax relief. Next slide, please. I think before COVID, this is a model of sort of where we can sort of look at how the charities could be looking at volunteers, people with like-minded sort of ideas to sort of help people in need, looking at fundraising events within our own sort of societies, as well as locally, as well as nationally, looking at selling products, for example, like the PPE in this time of COVID, sponsoring events, and also advertising to bring in more tax donations. But after COVID, we can see that we can't do the fundraising events because, as you may have heard the news, England is in the second national lockdown as of from the next 3 days. We're going in for 4 weeks of national lockdown. So we can't be doing any fundraising events or doing any sponsoring events. Next slide, please. So I think my message is, but in UK as well as across every region, is I think we shouldn't cancel our campaign. I think we need to adapt and change to the challenging scenarios and the unprecedented times we are all facing. And this is not a problem that is localized to one part of the world. It is estimated that nearly 50% of the funds will be lost by charities. I think we need to be innovative. We need to look at our own fundraising sort of projects. And there are some ideas which what as Neelima and her team have shown from USA, which we could adapt here in UK. And rather than reinventing the wheel, I think we could look at those projects while we are in this unprecedented time. And also, I think during this time of crisis, we have connected with our family and friends through Zoom or through Teams or many things. And I think we can use this as an opportunity to organize more sort of social connecting and connecting with friends and families and raising funds through social media. And I'd like to conclude by saying is, I think from what Sai and her has started, I think this is about right care for the right people. And I believe not just in UK, but all over, whoever is connected with UK, ACAM, together we can change for a better world. Thank you.